Without a doubt, the most common injury we get is back pain. At this stage, we could fix it with our eyes closed. The most severe people coming in after going through operation after operation or not, or maybe it's just generalised back pain that it's hindering you in some way, shape or form. Self-employed people in particular, they can't afford to be able to work so often. The fear response that this develops is unbelievable when the back goes. We all have done a disc or we've done, something at some point, and it completely can take you out. You're paralysed essentially for a couple of days, and it makes you realise just how temperamental the back is. A lot of us are going around and we're told, I have a weak back. Now, I guarantee you there's people watching this to know someone and they're sick and tired of them saying that sentence, okay? The ones who are saying you have a weak back, it couldn't be any more from the opposite, okay? It's that the back is constantly stimulated. So you're in this position all the time. So every single bit of tissue here is completely shortened. It has developed scar tissue upon scar tissue. So you're the type that when we go to try and skin glide along here, that tissue doesn't move, okay? You've been locked into that pelvic tilt. So first thing in the morning, your typical complaint is you're getting up, you're a couple of minutes waiting to get going, and then you're fine as the day goes on. You may be bending into the boot of the car, picking a baby up, and so on. These are the common things where people say the back just went on me. It had been waiting to go, it was highly fatigued, and it was ready to, pop at any time. Whether you've been told from the most severe case back, so dehydrated discs, okay, well, that's where we talked about cerebrospinal fluid, looking at the function of your sphenoid bone, your cranial bone. Is the fluid actually being able to pump through the body effectively? That's what will stop any disc getting dehydrated. The biggest impact is going to be gravity pushing on you all day. So if you're somebody who stands in their job, of course you're going to get tired, of course you're going to slouch. And again, what do? You lean back to try and alleviate the pain. And in that one quick movement, what you're doing is you're shortening the muscle fibre even more than it should have been. Okay? Essentially, when you come to the clinic, all we're trying to do is not only, we rarely touch the back. We're trying to treat you from the front again. We're trying to take the stress response out of the tissue here, working on all of this area of the body. Okay, by taking that out, people's back pain disappearing straight away. But in the rehab again is where it really complements it. Okay, stop relying on your back. Stop doing back stretches, back arches. Focus on the 29 to 30 muscles that are in the front of the body. Develop them, and they will support that spine. Through the rehab again, you're going to get yourself out of this tilt, or perhaps you fell into a proper disc issue where you're completely caught in this plane of motion. You know exactly what I'm talking about if you're one of those people. But they say if you scanned everybody walking the street anyways, we'd have a bulging disc, and that is all because of gravity again. So get in touch if you are somebody and you're sick to the teeth of having to take time off work or whatever it is.